Cancer refers to any disease in which the abnormal cells divide without any control and they can invade the nearby tissues. The signs and symptoms of cancer mostly depend on where it is, how big it is, and how much it affected the nearby organs. People who are diagnosed earlier with cancer are not only more likely to survive, but also to have better experiences of care, treatment, and quality of life. And that's why it is really important for you to know some general signs and symptoms that might represent cancer in order to do something about it as soon as possible. Hello and welcome back to Dr. Solar channel. This is Dr. Fatima and today we are going to talk about some common signs that might represent cancer. So let's go. In 2014, there was this article published in one of the best cancer journals in which the authors evaluated the signs and symptoms of cancer in relation to its severity and its grade. Their results were really interesting and they showed that the signs and symptoms that you present differ significantly based on if you are in the advanced stage or in early stages of cancer. For example, they found that having a neck lump was associated with greater risk of advanced disease, while symptoms such as abnormal mole, breast lump, postmenopausal bleeding, and rectal bleeding were associated with lower chance of advanced disease. This map shows that we tend to see higher prevalence of cancer in high-income countries. For example, in the USA, the prevalence of cancer is 5.5%. Now, let's talk about some common symptoms that might be indicative of having cancer. The first sign is very heavy night sweats or fever. Now, this sign can be caused by infections or even during the menopause, but it's better for you to talk to your doctor if you have this sign. The second general sign is fatigue. Now, there are loads of reasons that you might feel tired all the time, especially if you are going through a stressful life and you cannot sleep well at night. But if you are exhausted all the time and you don't find any reason for that, it's not a bad idea to see your doctor. The third general sign is unexplained bleeding or bruising. Now, when you have not hurt yourself, but you still have bleeding or bruising, you better be checked up by your doctor. This includes having blood in your stool or your urine, or if you are vomiting or coughing blood, or even if you have any unexplained vaginal bleeding between your periods. No matter how much blood or what color the blood is, it is still important. The next general sign is unexplained pain. Now, pain is the way that our body tells us that something is wrong, and as we get older, we are more likely to experience pain more often. But unexplained pain and persistent pain can be a sign that there's something more serious. The next general sign is unexplained weight loss. Now, losing weight is not that abnormal, but if you lose a significant amount of your weight without even trying to, well, it's worth telling your doctor about it. The last general sign that I want to talk about is unusual lump or swelling anywhere. This sign is really important and should be taken seriously. This includes any lumps in the neck, armpit, stomach, groin, chest, breast, or testicle. Now, let's talk about some common signs of cancer in each organ. So firstly, we're going to talk about the mouth. So if you have some persistent ulcers and stitches that won't heal at all, or if you have difficulty swallowing, these signs might be indicative of cancer. You should always consider that there are other reasons that can cause difficulty swallowing, such as reflux, and there are other reasons that can cause ulcers in your mouth, especially when you are a little bit run down. But if it is persistent and it doesn't go away, then it's better for you to consult your doctor. A sign that can affect your voice is hoarseness or croaky voice, which is actually normal when you have a cold. But if it doesn't go away and it persists, it's better to check it out. Now let's talk about the signs that you might see in your abdominal area. The first one is persistent bloating. Well, it's quite common to have a bloated tummy from time to time, but if it is persistent and if you feel bloated all the time, it's better for you to talk to your doctor. The next abdominal signs are appetite loss and persistent heartburn. Now, as you know, there are a lot of other reasons for appetite loss or heartburn, but if they are persistent and if you cannot do anything to make them better, so it's better for you to see your doctor. Other signs can affect your urination or defecation. For example, you have to go to the bathroom more urgently or you have pain while urination. You also might experience persistent constipation or diarrhea. Okay, now that we know a little bit about the common signs of cancer, let's talk about risk factors. The first risk factor is age. Cancer can take decades to develop. That's why most of the cancer are diagnosed in people higher than 65 years old. But it doesn't make cancer an exclusively adult disease. It can be diagnosed at any age. The other important risk factor is your habits. And what's really good about this risk factor is that you can control it and you can change it. Some specific lifestyle choices are known to increase your risk of cancer. Smoking, drinking more than 1 drink a day for women and up to 2 drinks a day for men, excessive exposure to sun or frequent blistering sunburns, and being obese can contribute to cancer. Another risk factor for cancer is family history. A small number of cancers are due to an inherited situation. So if you have a positive familial history, meaning that you had a lot of people in your family that had cancer, there is a possibility that a mutation has passed from your last generation to you. But you should always have that in mind, that having an inherited genetic mutation doesn't necessarily mean that you are going to get cancer. Now, if you don't have any of the signs, but you still want to prevent yourself from getting cancer, here are some tips for you. The number 1 tip is to stop smoking if you smoke, because smoking is linked to a number of cancers, not just lung cancer. So if you stop smoking right now, you are going to reduce the chance of having a lot of cancers in the future. The second tip is to try to have a healthy diet. Select a diet that is rich with fruits, vegetables, whole grains, lean proteins, and try to avoid processed foods and meats. The third tip is to exercise. Try to exercise most days of the week. Regular exercise is linked to a lower risk of cancer. Aim for at least 30 minutes of exercise most days of the week. If you haven't been exercising regularly, start out slowly and work your way up to 30 minutes or longer. The fourth tip is to avoid excessive exposure to sunlight, because there are some harmful rays in it that can increase the risk of skin cancer. Another tip is to drink in moderation. So if you decide to drink alcohol, try to drink it in moderation. That means that if you are a woman, you can drink up to 1 cup per day, and if you are a man, you can drink up to 2 cups per day. Another tip is to take cancer screening exams, so you can talk to your doctor about the cancer screening exams that are best for you. And my last tip is to ask your doctor about immunization. So they are specific vaccines that can decrease the chance of you having cancer. For example, HPV vaccine or hepatitis B vaccine. So you can ask your doctors which vaccines are appropriate for you or if you need to take them. At the end of this video, I just wanted to mention that if you have any of the signs that we mentioned, don't freak out. These are mostly general signs, but just you can call your doctor and ask them to run some tests to assure you. That was it for today. Thank you guys for watching, and please don't forget to like, share, and subscribe. And also, if you have a medical problem that you think I can help you with, please leave a comment below and I'll try to answer it as soon as possible. Bye!